To help lead the response against the increasing coronavirus pandemic, the Calhoun County COVID-19 Unified Command System has been established and put together a guide for what's to be considered priorities during this time. The incident commanders in the Unified Command are a group of first responders and healthcare professionals that are responsible for the entire operation. The purpose of establishing the county-level Unified Command is to ensure the county's response is coordinated and organized to properly support hospitals, EMS, and other first responders. It will also provide a platform that will allow for the integration of local, state, and federal agencies to operate under one unified overall management structure. Incident commanders have put together a guide of priorities for all members in the Unified Command System to follow on a day-by-day basis.
The first thing we're looking at is first responder safety and first responder and healthcare worker support, that we've got mechanisms in place by which we can support them. The second is good data and modeling so that we can have good information to make good decisions on and make sure that we're providing the resources, the adequate resources that we need for the operation. Third is capacity, that we want to make sure that we've got continuity of response in the field in terms of emergency calls to service to residences.
According to Barton, the final priority is the supply of necessary resources to meet the incident objectives. This includes sources and logistics for PPE, critical medications, ventilators, and coronavirus testing resources. Barton says the priorities are equally important, and each priority is assigned to a team to ensure that Calhoun County is responding the best way possible to the community's needs during this pandemic.
We have daily coordination calls in the morning with the command staff and the operations section chiefs to make sure that we're on target, that we know what our priorities for the day are, and that we're working to meet these objectives and the priorities that we've laid out. Sometimes hourly we are interfacing from the command back to our section chiefs, and they're constantly working on these objectives that we've put out.
Barton says the command system is an added responsibility for those involved to continue doing the mission that they're called to do while still fighting the battle against COVID-19.